For many people, the struggle of living with digestive symptoms truly affect their everyday lives. And for years, they have been told these symptoms are normal, stress-related, or unexplained. Symptom drugs are suggested, and they are encouraged to move on. Well, patients at Sarasota Center for Acupuncture and Nutrition can expect a different approach. Dr. Christina Captain joins us now with what kind of approach you take and how it is very different. Welcome to the show. Thank you so much.
Great to be back.
Let's talk about that. How do you approach people differently and give them hope?
Well, first of all, we want to make sure that they're heard, right? Because so many times these symptoms are so proliferative in society now and just sort of like an everyday occurrence, and they're not emergent situations. It's not something that typically you probably need to see an emergency room for, right, and a physician there. So a lot of times it's just dismissed, and so people don't feel heard. They don't feel like someone's listening to them and really hearing what they need to do about it. And that's what we're coming different. We really want to listen to what's going on.
Well, that's awesome, because I know when you're at that point, you need someone to listen and to take it seriously because you're there for help. You have the ability to combine advanced training in Eastern medicine with modern functional assessment strategies. Talk to us about that,
So
please.
that's the idea, right? So I have the maximum amount of training you can have. I have the advanced practice doctorate in Eastern medicine and acupuncture, and then I went ahead and got another master's degree in human nutrition, which was focused in functional medicine assessing. So when we're looking at functional tests, we're taking something that is not necessarily just a marker that's going to tell us something's way out of balance. It's really looking at how does an organ function or how does a system function in the body. In this case, we're looking at stool testing. There's a fantastic stool test that really shows us everything from how the stomach functions to how the intestines are functioning, and whether or not you have a permeable gut, or whether or not you have a malfunctioning pancreas where your your pancreatic enzymes are too little and you can't digest well. So these tests really tell us a whole pathway, So in Eastern medicine, we get to the root of the problem, but these tests actually show you a marker for that, and many people like that.
Yeah.
In Eastern medicine, we don't have a test you can take and a marker, just like here's a pattern of symptoms.
Right.
But here now I have a test, and here's this marker. Let's fix it.
All right, so we talked about how you're different and how you're able to listen and approach this differently. What are the symptoms that are red flags where we're like, all right, we need to call Dr. Captain right now? What are those symptoms?
Well, red flags are a little bit different. So if we think about why you would call me, chronic acid reflux, you want to get off your PPIs. There was just an article that was actually talked about by a neurosurgeon about glioblastoma, which is a brain cancer, and proton pump inhibitors, which is like omeprazole and pantoprazole, and how those particular drugs accentuate this glioblastoma or tumor from continuing to grow that prevent the treatment from being effective. So we want to make sure that people who are on those kinds of drugs actually call their oncologist and say, should I still be on this drug? So things like that. If somebody wants to get off those drugs and they don't have a glioblastoma, call me. If they have chronic nausea after meals, chronic diarrhea and constipation, pain. But big red flags are lots of bleeding, right? Things that are massive pain. That's emergency room. That's call your primary care. That's that kind of a red flag. For me, it's these chronic problems that people just dismiss you about. You can come see me and I'm going to help you fix it.
Let's talk about your patients. You are known for individualizing a lot of your patients, listening to what their problems are and giving them hope. Let's hear from one of your patients and we'll talk more on the back end of it.
I like it.
The very first thing that Dr. Captain did for me was to change my diet. I was pre-diabetic from a family of all diabetics, and I was determined not to go on medicine if I could help it. So she put me on an anti-inflammatory diet, which immediately improved that. From there, we proceeded to helping me maintain my health and my lack of pain with the sciatica that I've had since I was a young girl. And right through to COVID, the effects of long COVID. She was the one who figured it out. Without that, I think I would still be in bed. But I am feeling so much better. Then I'm back to teaching at school, and life is good. I have emotion. She is the most caring of any professional healer that I've ever gone to. I can tell you that Dr. Captain has made an enormous difference in my general life, and I trust her completely with my health.
That's got to make you feel good. One of the things that she said that stood out, she called you a professional healer.
Yeah.
And that's huge. You know, talk to me about the goal you have as a healer for your patients. What do you want from that for them when you're done?
So really it's about helping them get to where they want. So everybody just wants to be able to live their lives, right? Pain-free, feeling happy, not worried about what the future, their health will be. So I want what they want for them, and I'm able to give them the pathway and the hope to get there.
I love it. Thank you so much. You can learn more at scansrq.com, and we'll be right back.